Although advanced care planning often involves a difficult discussion, as physicians, Eric and I can't overemphasize its importance.
Too often, families are required to make critical healthcare decisions on behalf of their loved ones without even knowing that person's beliefs and wishes. This can make a stressful situation very much more stressful.
On this week's Health Talk, we'll explain what's involved in advanced care planning and why these discussions with your loved ones are so important.
So stay tuned, we're up next. Hi, I'm Dr. Eric Mazer.
And I'm Dr. Andrea Peterson. Today we'll discuss the importance of advanced care planning. Joining us is Dr. Joseph Joachim. He's an internist with the Associated Internists of Darien.
So, glad to have you on the show. You're
Thank
also
you
a
so much for being
geriatrician.
here.
Thank you very much.
Trained in geriatrics.
Yeah.
So you deal with these issues of end-of-life decisions all the time.
Yes.
So why is advanced care planning, so why don't we take even a step back, because that's a little bit of jargon. What is advanced care planning? What are we talking about?
So advanced care planning, as the name indicates, it's planning ahead of time about our health care. What would we want? What's important to us? It's not, honestly, it's not about death. It's about life. It's about love. It's about personal preferences and beliefs. What would we want to be done when our medical condition is terminal? When our situation, like it's irreversible? What do we want to be done when we're not able to talk for ourselves? So advanced care planning is a way to put a voice to our choices when we need them the most. And honestly, it helps, like if we plan ahead of time, it will help our loved ones to make the decisions for us. Because like making decisions for someone else can be really traumatic.
Right. I know that having dealt with this many, many times as an oncologist, if families have not discussed the patient's wishes ahead of time, there's a guilt that they feel about withdrawing care. And I guess maybe one thing we should say is the default is legally, sort of morally and ethically, unless the family tells us otherwise, we as physicians are really required to provide all the care that's necessary to maintain life.
And I think it's important to, as background, to say there are a lot of technologies we have access to in medicine in the United States. There are a lot of things we can do, but really what we're talking about is what would someone want, knowing that some of those interventions may be invasive or uncomfortable and may or may not help.
Yes, and they might be, like, you know, like I'm not glad to say, but some intervention might be prolonging death instead of preserving
So
life.
I think people often think about this as, well, we'll turn off the respirator.
Yeah,
We'll pull the plug.
we are way beyond
But
that.
it's much more subtle than that. I think that we were discussing before the show, elderly parents, how much health care do you provide to them? Do they go to the emergency room every time they fall? Or do you spare them that tremendous workup if you can? And I think it's important to understand the people's wishes before you start to pull back in how aggressive you are.
Yes, I agree. You know, there are several ways to start doing advanced care planning. I think the best way is you can talk with your healthcare provider, whether a physician, cardiologist, any physician that you're closest to, and ask them about what is available now. Like what can we do? Because we're not only talking about like resuscitation. We're talking about feeding tubes. We're talking about rectal tubes. We are talking about external defibrillators, internal defibrillators. We have so many interventions. So you need to know what's available. And we're talking about when the situation is irreversible. We're talking when you are terminally ill, that you cannot go back to your baseline where you want to be. So so you have to think about what's available. And once you know what's available, what can be done, what inventions can be done, you have to reflect on yourself and think what's important for you. What would you want?
And understanding that I think there are different people in different cultures
Yeah.
that value different things. There are some cultures that in fact believe that life, regardless of the status of one's consciousness, needs to be extended as long as possible.
Yeah.
There are others that believe that that's suffering.
Yes.
and that we shouldn't use artificial measures. So
Well,
I
they
think
want to focus on quality of life
quality,
rather than
right.
duration
And
of
a
life.
low quality existence is not, and it doesn't have to be unconscious or not conscious. Someone can be in pain and conscious,
Yeah.
and not want their life to continue.
Yes. But as long as you know what's available and you reflect on yourself and make your own decision, I think you're guaranteeing that when the time comes, your life preferences would be done.
There are a lot of documents out there. Maybe, Andrea, I know you've worked in hospice.
Yeah.
Maybe we could discuss some of the state-provided documents about advanced directives,
Yeah.
The healthcare power of attorneys, and how that fits into this conversation.
So I think, like after you know what's available, you think about it, discuss it with your loved ones, and now it's time. And now it's time to write. You can start working on writing an advanced directive. Advanced directive is a legal document, but it doesn't have to be done in the presence of a lawyer. So it's a legal document, and it has, I think, two main roles. The first part is advanced directive should include your living will. And living will is the part where you put like what would you want to be done? What's your preferences? Which interventions you do not want to be done and which interventions you would want to be done. And this part is where we need to be as specific as possible. Because as the more specific we are about the intervention that will be done, this will leave less gray area for our loved ones or whoever is making the decisions for us to wonder what would we have wanted to be done. So the more specific, the better. And then the second piece of information that's really important is who do we want to be our healthcare representative? And we can choose more than one person in any order that we would prefer.
But it's so important to have a single representative, because I think Andrea and I, and I'm sure you have seen, so not infrequently, families where different family members have different objectives or different issues that they're working out, and will have differences of opinion, and that doesn't serve the patient well.
I agree. That's a good point. That's a good point. Or in that case, you can put like, who do you want to be your first choice, the go-to option.
And I think, as you mentioned, advanced directives are somewhat limited, and so important is having the actual conversations with your loved ones and with the person you've designated your healthcare representative. Sometimes I've met patients who have said, well, I want my daughter to make decisions for me if I can't make them myself, but had never told her daughter. So you need to make sure that your healthcare representative is willing and able to make those decisions and really understands what you would want, because in a piece of paper document you can't really anticipate every outcome or every possibility.
I was going to say exactly that, and I think also these things may change over time. It may be that at a certain point in your life you're really looking forward to seeing you want to live to see your grandchild's graduation from college, and even if you're disabled in a wheelchair, that's really important to you. Whereas, at a different time in your life, that may not be. If you're disabled and you get an infection, you may not want treatment. I think it's a fluid discussion as well.
It's a fluid discussion, and this document is not. If you want to change, you can change.
That's so important to say. Yeah.
But as you said, it's very important. Like, if to have something written, it will not cover everything. It's important to discuss our life philosophy with our loved ones. But then if we have it written down, it's important to keep it with whoever we assign as our healthcare representative. We can keep a copy with our religious leader if we have one. We can keep a copy with our lawyer if we want to, and we can keep a copy with our physician, because our physician.
A lot of office practices are actually asking for these documents now, and certainly I think there's a law now that is when you enter the hospital. Andrew, you would know this. Don't hospitals have to ask for those documents, the advanced directives, if they exist?
I actually don't know if it's a law, but I know in Western Connecticut Health Network, as a practice, we always try to ask who would you like to make
rather than a law, but
your decisions if you can't, and to talk with patients as they're coming into the hospital about those issues.
And like I work in the outpatient. Let's say if I see a patient and I have the advanced directive, I put it in his electronic medical records. The people from the hospital, they have access to my electronic medical records, so they can see the documents, so they can do the best for the patients. Because, it's not an easy
When should you start having these discussions? How old?
That's a very good question. You should start thinking about them as soon as possible, and as you said, as we age, our priorities change. But and then we can change our thoughts too. So, but like it's never too early to start thinking about them.
And one specific circumstance a younger person might want to talk with about with their families would be organ donation. We know that one thing that younger people can die from is injury or accidents, and letting your loved ones know if you would like to be an organ donor can really help them if that terrible situation occurs.
That's a good
right,
start.
and understanding, again, there are different cultural views of this.
Yeah.
But they're all fine. I mean, there's not to pass judgment on any one of them. But I think that, again, if your culture and you personally feel that organ donation is something you want to do or feel good about doing, I think you should absolutely do that. I know I certainly have that on my license.
Yeah.
I guess the Connecticut license carries whether you're an organ donor, and I don't know anybody would want my organs at this point, but they're available.
From a physician's point of view, when we're taking care of a patient, what we want to make sure we do is to understand what our patient would want. If they can't tell us to do
this is the principle of autonomy,
that
we want our patients to be able to make decisions on their own behalf with regards to their health care.
Like from the physician point of view, like when we're seeing someone, let's say, it can start any time, but it can start, let's say, for the welcome to Medicare visit. When they turn 65, they see you in office. Part of the visit is talking about, do you have advanced care planning? Or at least just discussing with the patient, explaining what it is. And as you said, it's a fluid process. It doesn't have to be done today.
Right.
You just start to think about it, talk with your loved ones.
You made the important point that it can be changed too. And I think some people are so afraid, I'm going to make a decision today and then not want to. Well, tomorrow, if you want to change that decision at any point, you can. And we have to, unfortunately, wrap up because we've run out of time.
Such an important discussion.
It really is. We can't talk about this enough. Yeah. We want to thank our guest, Dr. Joseph Joaquin, for joining us on Health Talk today.
Please send us your questions and comments at healthtalk@wchn.org. Eric and I would love to hear from you.
So thanks for watching. And if you don't have this discussion, you haven't had this discussion with your family, please do so. It's so important.
Take care.